Welcome back. According to the CDC, cesarean sections are the most common surgery performed across the U.S. No surprise, you probably know many people who've had one. But despite how often they are performed, it's not always talked about why people are recommended them or why it's necessary in any given birth. So now's as good a time as ever to dive into this today because it's Cesarean Awareness Month. Thank you for joining me today. I have Dr. Abby Barnes, OBGYN from HCA HealthONE.
Thank you for having me.
Thank you. You probably do a million of these cesarean sections all the time.
You know, we do perform them regularly.
Yeah. Let's talk a little bit about there's a million things that can happen between the time someone's ready to deliver a baby and the baby arrives. What is kind of a common reason in advance you know a mom's going to need a C-section?
Yeah, so
versus like an emergency one, right?
Yeah, the reasons for planned C-sections tend to be breech presentation, meaning the hips are down instead of the head, or someone who's had a C-section in the past. So those are the most common reasons why we say, okay, we recommend a C-section.
Something in advance. Now, of course, there's always a situation, and I know so many girlfriends of mine who've been in an emergency C-section. The day of the birth, something's going different than planned. What would lead a mom to be in that position?
There are a couple of reasons. We look at baby and at mom. And so sometimes babies don't tolerate labor. And so there are a lot of interventions that we can do to try to make that environment more safer for baby. But sometimes we just can't proceed with a vaginal delivery.
Okay.
There are other times where a woman might not be progressing in labor despite the tools that we have, or she might have pushed for several hours without making any what we call descent, or the baby not coming down. And so those are other reasons why we might recommend a C-section.
When you're working with a patient leading up to delivery and you're talking about, I know when I was pregnant, we had a lot of conversations about here's how we plan A, but here's all the things that could be plan B. What kind of questions do you get? What kind of myths do you feel like you have to debunk? What does that conversation look like with your patients?
You know, we always remind our patients that we would love for them to have a vaginal delivery as long as that is the safest route. Our end goal at time of delivery is a healthy mom and a healthy baby. And so working towards that goal and working towards a vaginal delivery, great. But sometimes, you know, these unforeseen things come up. And so we just try to prepare our patients to be flexible and know that we will be honest and open if we have any concerns.
What do you think people misunderstand about that? When you have a family who maybe is a little more nervous or resistant to the idea, what kind of debunking, I guess, do you have to do? Or just the questions that you get a lot that are like, that's not quite right, you might be getting this from the internet or whatever else?
Yeah, I think there are a lot of thoughts that, you know, OBGYNs just want to be done with labor. And we just want to do a C-section because we're tired of waiting. And I don't know any OBGYNs who operate that way. So I think knowing that, like, we're on your team and we want to work with our patients so that we can all be safe at the end of the day.
Don't you guys, like, you're always on call? That's kind of part of the job, is that you kind of exist in an always on call situation. Do you sleep ever?
You know, every once in a while.
All right, let's talk about recovery from C-section, because now you go home with this beautiful baby who's going to cry every 2 hours and need to eat, but you're recovering from major surgery too.
Yeah, women are up and walking within hours of a C-section, which is really amazing and just speaks to our amazing bodies, right?
Right.
But you are breastfeeding, you can carry your babies, all of that right after delivery. You are a little more slow moving. It takes a few more weeks to get back to the activities that you enjoy doing. But really those, you know, you can walk upstairs, you can take care of your baby, you can do all of those necessary things.
But you do have to take care of a scar. I hear a lot of people talking about like the wound care, if you will, right? Which might look a little different than if you had delivered a different way.
Yeah, definitely. You do have an abdominal incision that you have to care for. You have to, you know, make sure that it doesn't get infected. But, you know, we try to do a lot of teaching around the kinds of bandages to use and how to clean and care for that incision.
It's an interesting conversation to have because it is so common, right? This is not an emerging science. We've been doing this for decades, right? So I guess how is that conversation, and we'll end on this point, how is the conversation on C-sections today maybe a little different or changing compared to other points in your career and where you maybe see in the future?
Yeah, you know, I think our cesarean rate has gone up a little bit over the past few years, but overall we're in a very stable level. And I think we're all working to see how can we reduce our cesarean section rate while not compromising patient safety. And so I think that's where a lot of the conversation is right now. Like, what tools do we have in labor? What tools do we have to make sure babies are safe, moms are safe? And then really working on building that good patient-provider relationship so that we can have these honest conversations about what your risks are.
Yeah. Okay. Well, thank you, Dr. Barnes, for coming in and
you.
talking about it. And for any lady who is expecting a baby soon, best of luck on your delivery, however
Yeah.
the baby arrives,
Yes.
right? All right. Thank you. Appreciate you coming in today.